So this is a small mini lecture that we're going to look at some of the treatment options for diabetic retinopathies. A very simple learning objective: provide the rationale for using either small molecule inhibitors or monoclonal antibodies in diabetic retinopathy and other vascular diseases of the eye. This is a nice kind of summary diagram that I got from a recent journal article, and it distinguishes the pathology and the key immune players between diabetic macular edema and proliferative diabetic retinopathy. And so the goal of this is not to go into all of these nuances from the pathology side, but just basically appreciate that VEGF plays a very large role in the pathogenesis of these diseases. And so VEGF stands for vascular endothelial growth factor, and it's the key promoter of angiogenesis. And angiogenesis, of course, is the growing of blood vessels from new, or the sprouting of blood vessels from new. And this process is basically done by several receptors called the VEGF receptors, 3 of which are shown here. And basically what we're going to do is we're going to target these receptors to inhibit angiogenesis. And so these VEGF inhibitors seem to be better tolerated and have more positive clinical outcomes than steroids, which have been used historically to treat these conditions. These drugs differ in their specific target and the type of drug that they are, but as a group, they're all called VEGF inhibitors. You can further subdivide them into monoclonal antibodies. Bevacizumab and ranibizumab both have the suffix MAB, which stands for monoclonal antibody. And then another drug called aflibercept, which is really a small molecule inhibitor. Bevacizumab is a humanized monoclonal antibody to IgG1, and it binds to VEGF. So this is pulling out soluble VEGF in the environment. We're going to prevent VEGF from binding to its receptor, and these receptors are found primarily on endothelial cells. Bevacizumab, specifically under the trade name Avastin, has been approved for renal, lung, ovarian, colorectal, and glioblastomas, and in all of these diseases it's administered IV. In the case of the eye, we can see this drug being injected right into the eye. And understand that ranibizumab is essentially bevacizumab with some modifications. It's actually derived from that. It's a smaller portion of that molecule. Aflibercept is a recombinant fusion protein which also binds to VEGF, essentially binds to and soaks up soluble VEGF. Typically it's given about 1 infusion every 2 weeks, but that depends on what it's indicated for. And the indication list, which is shown here, has grown quite long actually. There's 4 now indications for this drug. And so just to kind of quickly summarize, what we're looking at is we're looking at, here's the VEGF receptor, and here's soluble VEGF. And we've got a group of drugs that are monoclonal antibodies in nature. Bevacizumab is a great example. And we've got another group of drugs that are soluble VEGF fusion proteins, which essentially have the similar mechanism of action but a different binding site. Okay, so that's kind of a brief introduction to these drugs.